Thank you, Count Corla. Taoiseach, yesterday I put a question to the Taoiseach on promised legislation as to what plan was in place to deal with the chronic shortage of carers available to deliver the home care support service. So the scheme obviously was brought in by government to ensure that people can stay in their own homes with the level of support, and without such supports would be likely to end up in a residential or nursing home facility. Taoiseach, the budget granted a massive increase in the home care support hours available, and I was critical because there is no delivery. So without delivery, in effect, that increase is spin and it creates false hope. And nothing, Count Corla, is more demoralising for people, our older age cohort, to receive letters, our most vulnerable citizens, receiving letters, granting them and giving them the good news that they have been granted a home care support package, only to go to the next line which says, but we cannot deliver it because there's such a critical shortage of carers. So, in general, people receiving the letters have paid tax all their lives, their children are working and paying tax to contribute to the exchequer, and so as that we can provide these schemes. And yet a review of the critical skills requirements by the Department of Social Protection says no critical skills permit allocation is required within the sector, as recruitment difficulties and challenges faced by the sector are primarily due to contract issues and terms and conditions being offered. Now that's serious, Minister Taoiseach. It's not a money issue. It's not a money issue in that we have the finances to deliver the hours. I think what we're going to have to look at is that money being made available to the carers, and to make provision where those hours and the carers, particularly in rural Ireland, are using their own vehicles to drive from house to house on a level of hourly rate at $12.70 per hour. It's not making sense, and I think if we have an issue in the HSE with terms and conditions that transpires to the private sector, then we absolutely need to look at that. In the context, Taoiseach, so as it's in context, there are 5,000 people waiting on the home care hours. There's 1,000 of those people, a disproportionate amount in County Wexford. 1/5 of the overall total are actually in County Wexford. I have a lady, mid-70s, looking after her recently most unfortunate husband's accident. He's now paraplegic, he's mid-70s. She gets care 5 days a week. She gets no care at the weekends. She's on her own in her mid-70s, lifting her paraplegic husband. I have a lady who is in a nursing home for the last 18 months. She went there as a step-down facility on the basis, Count Corla, that she was going to receive home care support. She can't go home without it. She's there for 18 months.
Taoiseach.
I want to thank the Deputy for raising this important question in the House today. The Government is committed to better community-based services, shifting care to the home and offering greater choice for people. Progress has been made on the number of home care hours delivered through increased investment in recent years. And last year, Minister Butler has allocated additional funding of £150 million for home support. And this year's HSE National Service Plan sets a target to provide 24 million home support hours, which is 5 million hours more than was provided last year. It's estimated that at the end of September, some 15 million hours had been provided to over 53,000 people. And this is 2.2 million more hours compared to the same period last year. So a real increase in the amount of service being provided to people. The funding secured in Budget 2021 to provide these additional 5 million hours has been maintained for 2022. Significant inroads have been made in reducing waiting lists for funding approval for new or additional services, from over 7,800 in January 2020 to just 400 now. While waiting lists for funding approval for new or additional home support service have decreased substantially, there can be delays between funding approval and the provision of home support hours. At the end of September 2021, there were just under 5,000 people assessed and waiting for a carer to become available, and that is a significant increase from where we were in January of last year. Although there has been a steady increase in the number of people waiting to receive home support over recent months, it's important to say that the total number of people waiting for home support across both categories has reduced from over 9,000 at the start of 2020 to about 5,300 now. Efforts are ongoing to enhance the provision of home support and to meet existing demand, including through the ongoing recruitment of home support workers, though this is a challenge. In order to deal with issues around carer capacity in the HSE, it's endeavouring to prioritise service for clients with the highest care needs to ensure that service can commence for those who require it most urgently. And the HSE continues to recruit home support workers at local and national level. Minister Butler is committed to establishing a cross-departmental strategic workforce advisory group, and the role of the group will be to facilitate the views of stakeholders and examine workforce challenges in home support and nursing homes. Potential issues to be considered include recruitment, retention, training, career development, and the sustainable employment of home care workers into the future. A call for submissions to identify the issues that need to be considered and to inform the establishment of the group was announced just last Friday, and the Department's project team will analyse submissions received to inform the setting up of the group early next year.
Thank you, Taoiseach.
Thank you, Taoiseach. I suppose, Count Corla, look, what I'm asking is for Government, Taoiseach, Taoiseach and Minister Butler, who I appreciate is doing her best and a very good job, but I want to ensure that we don't wait till that review is complete to make good on delivery for carers. And I think, Taoiseach, you were previously Minister for Health. All we're going to achieve here without addressing this situation immediately is the total opposite of which the scheme was envisaged, and that is drive people into residential care settings and nursing home settings. I'm talking about your father, your mother, my father, people whose children are out working to contribute to the exchequer, who are doing their best on a scheme that was supposed to support those most in need. Our oldest, most vulnerable needs the service. There are several issues with the service. In Wexford, for instance, if someone is available, a carer is available in Rosslare and care is required some distance away in another district, such as Enniscorthy, Count Corla, well, the policy is that they will not be asked to go there because it's not affordable. And that's where I say we have the money to deliver the hours. We need to use some of that money to make it affordable and make the carers available. We can't continue like this. Thank you.
Thank you.
Thanks, Deputy. I take your point, and I think the arguments that you've made in the House are very well made. If home care is not available, what's the result? More people end up in hospital, more people end up stuck in hospital, delayed discharges, and more people end up in nursing homes long before they need to go into a nursing home, and that's not right, because people should have the autonomy to stay in their home for as long as they can. And as you acknowledged, it's not a matter of money. The amount of money provided for home care has increased really dramatically in the last couple of years. It's probably increased by 40–50%, if not doubled in recent years. And the kind of waiting lists that we had that used to be a result of inadequate budget are no longer the issue. The issue is finding and retaining adequate staff to provide home care, and that is a real challenge. One area that my department operates, as you know, is the work permit system, and home care workers are currently on the ineligible occupations list. In order to have an occupation removed from this list, there needs to be a clear demonstration that recruitment difficulties are solely due to skills and labour shortages in Ireland and the EA, and not to other factors such as salary or employment conditions. And certainly the view of my department is that removing home care workers from the ineligible list would not solve the problem. What we need is a more comprehensive, longer-term approach dealing with those wider issues that you mentioned, such as pay and career progression and cost. And I appreciate it needs to be done sooner rather than later.
Thank you.